Welcome to today's episode of the Fitness Blueprint Podcast, the podcast designed to help you start your own fitness journey. Today we are joined by an expert in diabetes, Dr. Sam Scott. Dr. Sam Scott is a CEO and co-founder of Enhance D, which helps people with diabetes exercise by providing guidance, coaching, and community. Sam has a PhD in exercise physiology with clinical and applied research experience in the field of obesity, diabetes, and continuous glucose monitoring technology. As an academic, his primary research focus has been on developing strategies to overcome the major barriers to exercise for people living with diabetes. His research has resulted in a strong academic output with over 30 publications in high-impact journals and numerous keynote and invited talks. I learned a lot from this conversation with Dr. Sam Scott, so I hope that you will enjoy this episode.
Thanks a lot for having me on the podcast. I'm an exercise physiologist. I've been studying exercise science for a number of years, like at university. I did a PhD in Liverpool in the UK, and a large focus of what I was working on was how to help people living with type 1 and type 2 diabetes start exercise and continue exercising. Half of the PhD was very much focused on people with pre-diabetes, high risk of type 2 diabetes, where I was studying different digital tools to help remotely monitor people with exercise and do at-home exercise-based programs. And then the other half of my PhD was around type 1 diabetes. I don't have type 1 diabetes. I think that's really important to acknowledge. But when I started working in this area, it became really apparent to me how challenging it would be on a daily basis to live with this, especially if you're interested in exercise. So the main question we were trying to answer as part of my research was, what is the impact of different types of exercise on blood glucose management? And can we kind of work out if there's a best way to start exercising, how you can go from not previously being exercising into getting more exercise? This led me to really kind of have a passion, particularly around type 1 diabetes. So after studying in Liverpool, finished my PhD, I moved to Toronto to focus on this completely 100% because Toronto is a very important kind of city for type 1 diabetes. It's where insulin was first discovered and given to children with type 1 diabetes. So they have a huge history around that type of research. After doing a postdoc there, I ended up being offered a position to move to Switzerland in Bern, where I was leading a clinical research group around exercise type 1 diabetes. Again, we were focused on nutritional and behavioral aspects around exercise and type 1 diabetes. And then alongside that, I was leading the research for a professional cycling team. And this pro cycling team was particularly interesting because all of the athletes had type 1 diabetes. The reason I was motivated to do that was because I wanted to learn the different kind of processes that were important for competing at a professional level and how that would be comparable to the work I was doing on a beginner level or normal level exerciser. I've continued doing this type of research, and this has led me to want to focus more on the way that data is being put together around exercise with type 1 diabetes and how we can better understand the impact of exercise and glucose management around type 1 diabetes.
Explain diabetes to me like I have never heard of it before. Maybe I've just recently gotten a diabetes or a pre-diabetes diagnosis. How would you explain that to somebody? I know there are many types or multiple types of diabetes.
So exactly, there's different types. The most common are type 1 and type 2 diabetes. You do have additional types, for example, gestational diabetes, which is diabetes that's experienced during pregnancy. But to focus on type 1 diabetes first, so this is an autoimmune disease. This happens very rapidly in that for some reason, which is not completely known at the moment, which could be some combination of environmental or hereditary factor, your beta cells in your pancreas are attacked to the point where they stop producing the hormone insulin. And then this causes you to have the inability to manage your blood glucose levels yourselves and leads to a situation where you need to manage your glucose by administering insulin and monitoring your glucose, either with a glucose monitor or by doing blood checks. Most common type of diabetes is type 2 diabetes. So this is a much more chronic condition. This is something that develops over years, and it tends to be associated with lifestyle factors. So like inactivity, a lack of exercise, physical activity. It's also associated with diet as well. And this is where over time you become less insulin sensitive. So your body stops responding to insulin so much that you're producing. This leads to a situation where your body has to compensate by producing more of its own insulin. And eventually it leads to a point where your blood glucose is at a chronically high level and might develop to the point where you don't produce enough insulin and have to start administering insulin yourself. This as well will involve regularly checking your blood glucose, and you'll be given different medications to manage this.
Why is diabetes so bad? So we know that blood glucose levels can get all out of sorts, but what makes diabetes such a terrible illness or disease to be diagnosed with?
Diabetes is one of the biggest contributors to all-cause mortality uh, in the world. It's associated with various complications such as problems with the eyes, blindness, amputation. It's also got a huge toll on the person living with it in terms of daily demands. Um, you're more likely to have burnout. It's associated with things like depression. To kind of go into more details about this, so if we focus on type 1 diabetes, basically every day you're walking this constant tightrope between high and low blood glucose. Your body no longer has those mechanisms to automatically manage this. So if your blood glucose goes too low, you're risking what's called hypoglycemia. So this is a potentially dangerous situation that could lead to, in severe cases, coma, even death, potentially. On the other side of this, you want to avoid high blood glucose, which is called hyperglycemia. It's a very challenging condition to have because you've constantly got these decisions that you've got to make around managing glucose and avoiding going outside of this kind of safe range. If we talk about high hyperglycemia, the reason that this is bad is because this is associated with those longer term complications. So like what I was talking about in terms of increased risk of vascular disease, both like on the large blood vessels. So it places you at higher risk of things such as cardiovascular disease, but also on the small blood vessel side. So this is where it's damaging the blood vessels in like the eyes, the kidneys. It's also risks damaging the nerves, and this why you can have problems with like your feet, and this is where it leads to amputation. So it's really it's two things. Well, it's more than that really, but it's the daily toll on the person living with it in terms of managing it. And then it's the risk of like the complications, the illness that associates it and the costs.
Yeah, this is a topic that I struggled to really wrap my head around in school when we were learning about diabetes. But the way that I made sense of it all is if you're hyperglycemic or if you have higher blood glucose, blood sugars, if you can picture like a sugary candy that's melted down, it's really sticky, it's really thick. That's similar to kind of how the blood and the blood vessels get. They get kind of sweet, sticky, like because it's sugar, it's glucose, right? And so that damages like the vessels of the eyes and leads to things like blindness, or it damages the vessels around the heart, which can lead to cardiovascular diseases, among other potential other fatal causes. So that's something that kind of helped me remember it. Is that pretty on point there?
What I think is kind of fascinating about this, and it'll show you kind of the challenges and the big impact. So in an adult, you only have the equivalent of a teaspoon worth of sugar in your bloodstream all of the time. So that's equivalent to this measurement that you're kind of aiming for, which is normal blood glucose, is 5 millimoles per liter, or you've got in American units, it would be like 90 milligrams per deciliter. And this is equivalent to just 1 teaspoon of sugar. And your body is really good at maintaining this homeostasis. So this is maintained by the hormones, insulin and other hormones such as glucagon to maintain this. And if you think about the challenge of this, when oftentimes we consume drinks that will have like 10 teaspoons of sugar or more, what your body has to deal with in order to maintain that balance. And the reason it's maintaining that balance is for two reasons. You need to have enough glucose in the bloodstream to be providing energy. This is particularly important for the brain. So the brain mainly metabolizes glucose. So you've got to have a certain amount of glucose uh, to maintain that. And this is why when your glucose drops too low, you've probably experienced this as well. Like when, even if you don't have diabetes, you tend to feel kind of faint. You feel like you don't have energy. This is because your blood glucose is going lower, and your kind of your brain doesn't have this. And it's also why when you have something very sugary, it kind of there are other mechanisms, but it's part of why you kind of feel more alert. But on the flip side to that, it's similar to what you're saying. You need to keep it not higher than this, because a concentration that goes higher than this normal glucose is increasing the concentration too much, where it's actually damaging cells. And where this has the most impact is in the smaller cells, like in the nerve cells, like in the ends of your fingers, or in the small blood vessels, like in your kidneys, in your eyes, in your heart as well. And this is where it's having the balance. So it's really like about keeping that safe glucose.
So, we're talking about a disease that relates to blood sugar levels. How on earth do we connect this to exercise? So, what benefits would somebody get with any type of diabetes diagnosis to exercise regularly? After all, this is the Fitness Blueprint podcast. So, why on earth are we talking about a disease that pertains to blood sugars?
So exercise is so critical for people living with diabetes, whether it's type 1 diabetes, type 2 diabetes, in people in general. If we focus on type 1 diabetes for a minute, so um, often it's kind of said that there's these three pillars around diabetes, or kind of these core things. So you've got nutrition, um, you've got your insulin, and you've got exercise. And these have really significant impacts on blood glucose levels. So insulin has an effect on your blood glucose in that it's the hormone that acts on your muscle to lower the glucose. So basically, your body is always trying to keep that stable blood sugar level. When it detects that there is more sugar than is needed, then your body produces the hormone insulin, and then the levels are lowered, because this hormone has an effect which causes your muscles to take that sugar up into the muscles. Interestingly, exercise has an effect on blood sugar levels. So there are there are pathways within the muscles which act to stimulate transporters to move to the edge of your muscles to take up glucose. These are called glucose transporters. Insulin has an effect on these, and so does exercise. And these pathways are independent of the hormonal pathways. So if you're living with type 1 diabetes, these pathways are still intact. So you can still lower your blood sugar level with exercise. So this is why it's important. So by understanding the impact of exercise on your blood sugar, you can actually alter when you do exercise or the intensity of your exercise to lower and help manage your blood glucose levels. The other reason that exercise is really important, this applies to everybody, but it's kind of more it's particularly important if we think about pre-diabetes and type 2 diabetes, is that these are conditions where your body is placed in a condition of stress that leads to a lack of sensitivity to insulin. By incorporating exercise into your life, what you can do is reduce the reliance on insulin to lower your blood glucose. So, for example, there's really clear evidence that if you do a session of walking after a meal, your glucose, the rise in glucose after the meal will actually be reduced. And the reason this is because your body doesn't need to release as much insulin. The contractions just from that simple physical activity help with taking the glucose into your muscles, and it means that you have a lower glucose kind of spike during the meal. And by understanding this and by incorporating exercise into your lifestyle, it allows you to kind of improve your overall blood glucose management.
Yeah, wow, that's fascinating. Especially in Western medicine in the United States, a common belief is, well, I can just take a medication to help treat my diabetes and everything will be under control. If you were to argue for the case of exercise and lifestyle changes, what would you say to somebody with that mindset?
I'm very much in the camp of exercise, and I think that it's so important for everybody. Even if you're not somebody who is at this moment in time particularly at risk of uh, developing pre-diabetes, or you have type 1 or type 2 diabetes, I think it's important for everybody. There are so many aspects on the mental side in terms of stress reduction, in terms of community as well, which are important parts of kind of overall mental well-being. And these apply also to people living with diabetes. Diabetes places people at increased risk of things like depression, social isolation. So it's important to incorporate exercise into your lifestyle on these side of things. In terms of more physical aspects, exercise is helping with all kinds of aspects related to cardiovascular health. So the health of your heart, your ability to kind of take in and use oxygen, your balance as well. It depends what type of medication that we're talking about, but uh, no medication is without side effects. Exercise doesn't come with any side effects, really, other than maybe some risk of injury or something, depending on what you want to do. But there's really only positive aspects of it, whether it's building up muscle strength, which some medications actually reduce your muscle strength, it improves balance, it improves your cardiovascular fitness, improves mental health, everything really. So I would say that if you could develop a medication that had all of the benefits of exercise, it would be the billion-dollar drug. there isn't any such thing at the moment.
Yes, I totally agree, and I definitely set you up for that question. But you did sell me on that. That was a great pitch. So, what would the best type of exercise be for somebody with a diabetes diagnosis, either type 1, type 2, or gestational, any type of diabetes?
Actually, I wouldn't say that there is the best type of exercise. I think the best type of exercise is whatever you prefer to do. And it also depends when you want to do it and whether it's something which is a team sport or an individual sport, depending entirely on your preferences. Um, there are certain aspects to consider. Like if we talk about type 1 diabetes, and we can go into uh, more details about that, I still stand by the fact that there is no best type of exercise, but it's important to understand the impact of different types of exercise on your blood glucose so that you can better fit this within your lifestyle. So, for example, the type and intensity of the exercise has a very important effect on your blood glucose response. In general, and this is not always going to apply, but when you do higher intensity exercise, so if you sprint or you do heavy weightlifting, you will experience actually a rise in blood glucose. And the reason behind this is because there are other hormones that are released during this type of exercise, like adrenaline, noradrenaline, which actually have an effect to raise your blood glucose concentration. On the other side to that, when you do lower intensity exercise for a longer period of time, you tend to experience a drop in blood glucose concentration. And this is because you don't experience those large hormonal changes, and you're seeing the impact of those exercise or contraction induced uptake of glucose into the muscle. And that's the most powerful aspect there that's causing the lowering. My point here is that it's just a case of if you understand the impact of different types of exercise and the other factors that go around this, then you can actually better fit this in your lifestyle to maintain more stable blood glucose levels according to what your goals are. So another example I could give is if you're struggling to manage your blood glucose levels if you want to exercise after work, a lot of people living with type 1 diabetes will find this more difficult in the period after, because doing exercise late in the day can increase the risk of experiencing low blood glucose levels overnight. This can be managed with different things, but this is something that happens in a lot of people. So therefore, you might decide that you want to do your exercise in the morning before having had your breakfast and before having had insulin. And the reason that this might be very good is that without having that insulin injection beforehand, your blood glucose remains more stable. And then you are less likely to experience either hyperglycemia or hypoglycemia, both during and then also after. But again, it depends entirely on what your lifestyle is. So if you're not able to do exercise early in the morning, I would still recommend you do it in the evening, but it's just a case of understanding how you fit that in.
You kind of alluded to it a little bit, but what are some things that diabetics have to be a little bit cautious about when it comes to exercising? And
If we focus on type 1 diabetes, exercise is really one of those things which is a big challenge, especially for people that are newly diagnosed. And quite often what happens when people are first diagnosed with type 1 diabetes is they will stop exercising completely. There's all of these new additional kind of factors that you have to fit into your life, insulin dosing, managing your blood glucose levels and monitoring your blood glucose. What is the effect of different meals on this? And the first consideration really is how do I then fit in this potentially challenging behavior, which is exercise, into this complete like upside down situation of this diagnosis of type 1 diabetes. The other thing that's related to this is oftentimes clinicians don't have the information to help their patients with type 1 diabetes. It's not something where people in clinics tend to have a tool to help a patient around this. So it becomes a situation where often people are suggested just to kind of ignore exercise, stabilize your blood glucose, focus on other things for the time being, and then think about introducing exercise later on. This is a problem because you are at a point where exercise would be really beneficial if you did a sport previously. Perhaps you lose contact with the people that you were playing a different sport with. This can be more isolating. You've just had a diagnosis and then you stop doing sport with your friends. You struggle to kind of incorporate that within your lifestyle. And then when you do eventually start exercising, you then have an additional behavior that you've got to fit on top of a routine that you've only just managed to kind of stabilize. Those are big challenges, how you deal with the beginning and the diagnosis and staying active and not losing contact with friends. Other challenges include knowing all of the different factors that can impact your glucose during exercise. So we mentioned before, like time, the amount of time that you spend exercising, the intensity of the exercise, but you also have the insulin that you've taken before, during, or after, what's going on there that you have to consider. You have to consider nutrition, and there are various aspects as well, like caffeine, that can have a significant impact on glucose. So like if you have a coffee one day versus not on another day, this can impact glucose levels. Temperature is something to take into account. If you're exercising in the heat or you're exercising in the cold, it's something that you have to be aware of. Altitude can make a difference. So like if you go skiing, you'll see a different response versus if you're doing exercise at sea level. Yeah, there's also different kind of more practical considerations that you have to take into account. So before we were speaking with somebody who is a rugby player, they are in a situation where it's difficult to have anything kind of attached to them during games. Nowadays, we have different technologies that help with blood glucose management, like continuous glucose monitors or insulin pumps. He can't use an insulin pump because this would just get destroyed or detached. The continuous glucose monitor he does use, but the difficulty he has there is maintaining a certain distance away from his phone or being able to monitor what's going on during the length of a game. Other sports, you could go into different ones like swimming. There's different aspects, practicalities around that. There's other things to manage around responding to competitive versus non-competitive situations. If you are doing competitive sports, you tend to see a different glucose response versus a non-competitive sport. So these are all important factors to consider. If we think about type 2 diabetes and things to consider there, this will depend on what your kind of medical history is. This depends. Here, I would much more suggest speaking more closely with your healthcare provider about the types of medications that you're taking. There can be certain medications that lower your blood glucose. You might have other complications that can kind of be put more at risk when you start exercising. You may not have exercised at all for the last 10 years or longer, and introducing exercise can be potentially dangerous unless it's done under the right situation. So yeah, there's different challenges on both sides.
So there are a lot of things to be aware of when it comes to starting an exercise journey with a diabetes diagnosis, either type 1 or type 2. If you had to simplify things and give somebody a generalized protocol of, okay, here are some steps.
Yeah, this is quite a challenging thing because everybody is really different. If we focus on type 1 diabetes, um, I think that having support is really important. I think I would look for somebody else who's living with type 1 diabetes, especially if you're newly diagnosed or you kind of feel alone, because there you can sort of exchange ideas, what has worked under different situations. As I said before, you've got so many practical considerations, like how do I keep my CGM attached while I'm playing hockey, or how do I manage my glucose around this situation? It's also down to feeling less alone with the when living with type 1 diabetes, because it's a condition where it's been estimated that people living with type 1 diabetes have over 200 additional decisions every single day to manage their blood glucose. And if you feel like you're the only one in the world who's having to manage that, it can be really, really isolating. So I think that I would start by finding somebody else, um, trying to find a clinician that is willing to work through your exercise and kind of expressing the interest that you have to have exercise as an important part of your life. And then you can look at different technologies that are now available to assist in monitoring different aspects in your lifestyle, particularly around exercise. So continuous glucose monitors are great technologies that are increasingly available to people. These allow you to monitor what's going on with your glucose. And then you can look to start monitoring and incorporating information around what happened to my blood glucose when I did a certain type of exercise. How did nutrition impact this? And this will require a certain amount of trial and error to interpret how your glucose tends to respond under specific circumstances. And at the beginning, this will be really challenging. I would suggest starting off with kind of very high level, like being aware of the fact that intensity of exercise should impact the glucose response that I have. Then you start kind of monitoring and being aware of how this impacts things for you, how time of day impacts your glucose, how the length of time in which you had your insulin before exercise impacts your glucose is very individualized. There are resources and bits of information that you can find online, but it is difficult to find. That's why we are developing a tool which is designed to directly assist people to monitor what's going on in and around their glucose. And so people can start more easily tracking this and start getting into exercise. So basically, to summarize on that with type 1 diabetes, I completely sympathize that it's incredibly difficult. As I said at the beginning, I don't live with type 1 diabetes, but my motivation to get into doing this type of work was just seeing how incredibly challenging that it can be from a lot of people to just start doing exercise, and feeling that a lot of people would describe to me of being alone. So my advice is find a peer support network, find somebody else, find a friend who also lives with type 1 diabetes, try and help each other. Keep track of what's going on, spot patterns, and try and work through it like that. In terms of type 2 diabetes and how this is, my suggestion really here would be to work with your healthcare, like your doctor, more closely, understand your specific needs. It's much more difficult for me to kind of say things here about this because it really depends on whether you're taking insulin, whether you're not, the types of medications you're taking, whether there are any other complications that you're experiencing, whether you've exercised recently or whether you're just starting to get back into exercise. You really have to be aware of the risks that can come from being incredibly inactive for a long time and then just starting. But given the right kind of support around this, exercise is absolutely achievable, and it can be just starting from a very low intensity point of view, but it can be built in.
I just wanted to quickly mention just a few of the general guidelines that I've read from the National Strength and Conditioning Association here in the United States for somebody with type 2 diabetes, because you did mention kind of building up gradually. For sedentary individuals or people who haven't been physically active, the general recommendation is to start with 2 or 3 10-minute bouts of aerobic physical activity. That can be things like walking, light biking, something like that, and then progress to 30 minutes or more of continuous aerobic activity 5 to 7 days per week. And the goal is just to gradually build your way up. So don't expect to walk or run a marathon within a couple of weeks, but build up over time as you're getting into the swing of things. And that's great advice for anybody trying to get into fitness or exercise, is just to find what you can do now and then gradually build your way up. In terms of resistance training, they do recommend general 2 to 3 days per week, ideally resting at least 2 days in between, and just kind of doing a whole full body strengthening routine and then gradually progressing with that as well. So I think those are good starting points for people to go from. Any thoughts on that general protocol for getting into fitness with type 2 diabetes?
Yeah, I absolutely agree with that. And the reason for having those different types of exercise is because and this comes back to the kind of medication question, is that it's important to build up those different areas of your fitness, your well-being. The resistance training is so important because then you have the strength to do things in life. It's important for improving insulin resistance, like muscle tone. Stretching, the balancing work is important to reduce the risk of falls. And then the buildup of more aerobic exercise, walking, cycling, running. This is important as well for the cardiovascular kind of cardiorespiratory fitness that you want to build up. So yeah, having that kind of um, overall build up. The other aspect that I think that's important is reducing the amount of time that you're sitting. So having those really prolonged periods of sitting can be really dangerous as well. So trying to break that up, take walking breaks, because the power of just walking a little bit has such a big impact on kind of that the mobility, the uptake of glucose, especially if you're kind of walking a bit after having meals, that kind of thing. It's so important.
Absolutely. Fantastic advice. Sam, thank you so much for joining me on today's episode of the Fitness Blueprint Podcast.
Thank you for having me.
Thank you for joining us for today's episode of the Fitness Blueprint Podcast. Make sure that you subscribe so you don't miss future episodes, and let us know what we can do to make the podcast better. We appreciate any feedback that we can get so that we can make this the best possible resource for you while you're on your own fitness journey. Thanks again for joining. My name is Jackson Adamowitz, and we'll see you for next episode.